Brushing like you did in your 30s, you could be silently destroying your teeth starting today. Hi, I'm Dr. Michael Sanders, and if you're over 60, I need you to hear this. Last year, a retired Navy officer sat across from me, confused and in pain. "Doc," he said, "I brush 3 times a day, I use whitening toothpaste, I do everything right. So why do my teeth hurt more now than ever?" And that's when it hit me. The rules of brushing change after 60. But no one ever tells us. Instead, we keep scrubbing, whitening, rinsing, thinking we're protecting our health, when we might be wearing it away one tooth at a time. If you've noticed stinging pain when drinking cold water, or if brushing leaves your gums sore or your smile fading, this isn't just aging. It could be tooth sensitivity caused by 3 simple brushing mistakes nearly every senior makes. In this video, I'm going to show you the hidden damage and the simple changes that could save your smile, your confidence, and even your heart. So stay with me, because this might just be the most important thing you do for your health this week. Part 1. My turning point, the day it all changed. I remember it like it was yesterday, my 65th birthday. Still working as a dentist, hands steady vision, sharp but my teeth. They were letting me down. Every sip of cold water sent a jolt of pain through my mouth, like tiny needles jabbing straight into the nerves. Some nights, I'd wake up in a sweat because of that sudden stabbing ache. My wife Eleanor would look at me concerned and say, "If you're in this much pain, what about all the people who come to you for help that hit me hard?" And then I met Mr. Nikai. He was 87, thin frame, gentle smile, but wow, that smile lit up the room. As I checked his teeth, I was stunned. Strong teeth, firm pink gums, no signs of recession, no cavities at nearly 90. I had to ask, "What's your secret?" "Some kind of special toothpaste. Fancy electric toothbrush." He smiled and said softly, "I just brush once in the morning. Real gentle. Brushing teeth shouldn't feel like going to battle." Doc, I was speechless. Here I was, someone who'd taught and practiced dentistry for years, preaching 2 to 3 strong brushings a day. And yet, this man with his less is more approach had a mouth healthier than most 40-year-olds. That night, I couldn't sleep. I started digging through the latest dental research. Harvard, Johns Hopkins, the California Institute on Aging, trying to understand what I'd missed, and here's what I found. Something almost nobody talks about. Your teeth and gums at 60 plus are not the same as they were at 30. The enamel is thinner, gums lose elasticity. The tissues around the teeth become more fragile, more prone to inflammation. So when you keep brushing like you did in your 20s or 30s, you're actually wearing down the last bit of natural protection you've got left. Have you ever noticed that the more thoroughly you brush, the more sensitive your teeth get, or that whitening toothpaste you used for years suddenly makes it impossible to drink hot tea without pain? I've been there. And so have many of my patients. Take Maria, a sweet 76-year-old woman who once told me I thought brushing harder meant cleaner teeth, but I was damaging my gums every single day, and I didn't even know it. It sounded like a confession. But let me be clear, it's not her fault, and it's not yours either. Because no one ever told us the rules of oral care change as we age. Part 2-4. Truths that will help protect your teeth after 60. Truth number 1. Let me paint a picture for you. You've just finished a great lunch, maybe some tangy soup, a few pieces of fruit, and a glass of orange juice. Then, like you've done for years, you head straight to the sink, grab your toothbrush, and start brushing. You think you're doing the right thing, keeping your mouth clean, taking care of your health. But here's the thing. You might actually be harming your teeth without even realizing it. The first truth I want to share is this. Don't brush your teeth right after a meal. Why not when we eat? Especially acidic foods like juice, citrus, tomatoes, or vinegar-based sauces. Our tooth enamel temporarily softens. That enamel is like a thin shield that protects the inside of your teeth. Brushing right away is like taking sandpaper to that soft surface. Bit by bit, you wear it down, leading to sensitivity, gum recession, and long-term damage. I remember one of my patients, Mr. Trujillo, a 77-year-old veteran. He once told me I served in the military for 38 years. Woke up early, brushed my teeth after every meal, clean and disciplined, just like we were trained. But lately, my teeth have been super sensitive. Nothing tastes right anymore. Why is that, Doc? I asked him. How long after meals do you brush? He said, just a few minutes. I like to feel fresh. And I told him that might be the problem. Try waiting 30 minutes after eating. In the meantime, just rinse your mouth with plain water or some light, unsweetened tea. At first, he was skeptical, but 3 months later, he came back, shook my hand and said, I did what you said. My teeth don't ache anymore. I can actually enjoy my meals again. See a small change, big results. So after age 60, I always tell my patients, give your enamel time to recover before you brush. If you really can't wait, at least rinse gently with water or green tea. Green tea's got mild antibacterial properties that help keep your mouth clean. And here's another little tip. If you've had something really acidic, like pickles, orange juice, or vinegar, try to wait 45 to 60 minutes before brushing patience matters. Now I know changing habits is hard. You've done something for decades, and suddenly someone says, that might not be the best way. That's not easy to hear, but our bodies change. Our mouths change, and as we get older, we need to care for ourselves with more gentleness, with more thoughtfulness, like tending to a fall garden, not loud or flashy, but still full of life and color. So let me ask you right now, when was the last time you brushed your teeth right after eating? Have you noticed your teeth feeling more sensitive afterward? If so, try making a small adjustment starting today. Your teeth will thank you for it. Part 3, the second truth. The real cost of pearly white teeth. Imagine this. You're strolling through the toothpaste aisle at your local supermarket shelf after shelf rows of neatly lined up tubes, and one word keeps jumping out at you, whitening. It grabs our attention, doesn't it? A bright white smile is seen as a sign of youth, health confidence. At least, that's what every commercial wants us to believe. But here's a question. What's the real cost of those sparkling white teeth? I'll never forget one of my patients, Mrs. Martinez, 79 years old. Her silver hair, elegant outfit, and cream-colored cardigan gave her a graceful, dignified look. That fall morning, she sat down in my office, smiling proudly when I asked her about her dental care routine. She beamed and said, "Oh, doctor, I always use whitening toothpaste. Been using it for over 10 years. Everyone on TV has those beautiful white smiles. I just wanted mine to look the same." I completely understood, but as I started the exam, I had to lower my voice. Her teeth were thin, the enamel had worn down in several areas. Just a stream of cold air made her wince. A sip of hot tea, too painful. I gently told her, whitening toothpaste might give you quick results on the surface, but after age 60, it can be like sandpaper. It slowly scrapes away the thin enamel, which is already more fragile with age. And that's the second truth. I want you to remember, avoid using strong whitening toothpastes that contain harsh abrasives. They can damage your tooth enamel, the only natural armor your teeth have. It sounds simple, but many older adults overlook this. When we're younger, our enamel is thick like the tough skin of an apple. But by the time we reach our 60s or 70s, enamel can thin by 15 to 20%. If you keep using strong whitening products at that point, your teeth can quickly become sensitive and prone to damage. I remember explaining this to Mr. Carl, 68, a lifelong black coffee lover. He thought whitening toothpaste was the magic fix for his coffee stains. But here's the truth. Most whitening toothpastes are packed with ingredients like silica or high-concentration hydrogen peroxide, effective for surface stains. Yes, but way too harsh for older teeth. They don't just polish away stains. They strip away the protective layer underneath. That's why I told him, and every patient over 60, this: what you need isn't whitening. You need protection. A toothpaste made for sensitive teeth, one that includes fluoride and skips the harsh abrasives, is a much better option. And here's a myth I'd love to bust. If I use less toothpaste, my mouth won't feel clean. Actually, all you need is a pea-sized amount. The more you use, the more likely you are to dry out your mouth, irritate your gums, or overload on whitening chemicals. One more thing that's often overlooked: white teeth don't always mean healthy teeth. I've seen patients with ultra-white smiles, glossy and photo-ready, but their gums had receded roots, exposed teeth wobbly like dry leaves in the wind, and I've also seen patients with naturally off-white teeth still strong. No pain, no bleeding, and able to enjoy every bite of a good meal. So which would you rather have? I want you to remember. Your teeth are part of your body. They need care, gentleness, and respect. Choosing the right toothpaste isn't just about looking good. It's about protecting your health, feeling better day to day, and enjoying life's simple pleasures like a warm bowl of soup or a crisp apple without flinching. Because in the end, good health isn't about appearances. It's about feeling well, safe, and happy every single day. Part 4. Truth number 3. The harder you brush, the more teeth you lose. Let me start with a simple everyday question. Have you ever thought the harder you brush, the cleaner your teeth get? If you have, you're not alone. In over 30 years of working with patients, I can't tell you how many folks have told me the same thing. Convinced that strong brushing scares off the bad bacteria. And then they end up sitting across from me in my office, looking surprised, sometimes, even a little regretful when I tell them the truth. That very habit, the one they thought was helping, is actually pushing them closer and closer to dentures. Let me tell you about Mr. Gonzalez. 76 years old, sharp, disciplined, always neatly dressed. He believed firmly in one thing. Nothing is truly clean unless you use some elbow grease. He told me the moment he sat in the chair, "Doctor, I brush thoroughly. 3 times a day, 5 minutes each. I use the hardest brush I can find. But lately, my teeth feel loose and super sensitive, like a cold breeze goes straight to the roots." I examined him, and honestly, I wasn't surprised. His teeth weren't decayed, but his gums, they had receded so far back that the roots were fully exposed. A single breath of cold air made him wince. I looked him in the eye and said, "You've taken care of your teeth, but maybe not the right way." And that brings me to truth number 3. Don't brush your teeth like you're fighting a war brush, like you're cleaning a priceless antique. Gently and with care. You see, after age 60, our gums become thinner, more fragile, about 40%. Less resilient than when we were younger. If you're brushing hard with a stiff brush, it's like sanding away the last layer of protection your gums have. And what happens next? The gums pull back, the roots get exposed, then come the sensitivity of the infections, the loose teeth, and eventually tooth loss. One afternoon, I met Ms. Linda, 68, a retired teacher, beautiful smile. But I could clearly see the gum line had receded. Her teeth looked unusually long. When I asked about her toothbrush, she reached into her purse and pulled out a red one, with thick, stiff bristles that looked more like a wire scrub brush than a dental tool. She said, "I always thought hard brushes clean better. The soft ones don't feel like they're doing anything." And I told her, "That might have worked when you were younger, but now, what your mouth needs most is softness. A super soft brush, softer than even your eyelashes, is what will protect your gums and enamel." Now, I gave her one of those extra soft brushes I always recommend to my over 60 patients. She looked unsure, but 3 weeks later, she came back and said, "I can't believe just switching brushes made such a big difference. The pain's almost gone." So if you're watching this, here's what I'd love for you to take away. Swap your stiff brush for a super soft toothbrush. Right now, brush for 2 minutes only with a light touch, like you're wiping a mirror. Hold your brush at a 45-degree angle and use small, gentle circles, as if you're drawing tiny rings of care along your gum line. You don't need to be strong. You need to be smart. You don't need to scrub. You need to protect, because in the end, I truly believe we don't brush to defeat bacteria. We brush to live in harmony with our body, for the long run, with peace and health. Part 5. Truth number 4. Healthy mouth, healthy heart, healthy mind. There's a common misconception I've seen among many older adults, the belief that oral health is just about eating or looks or something minor. But after 40 years in this field, let me tell you with full honesty and professional experience, your mouth is never a small matter. I've seen patients suffer heart attacks triggered by gum infections. I've also met people whose memory started to fade, and the root cause wasn't in their brain. It was in their mouth. Sounds scary, right? But here's the 4th truth I want to share with you today. Your oral health directly impacts your overall health, your heart, your brain, even your immune system. One patient I'll never forget is Mr. Espinosa, 81 years old, living alone after his wife passed. He was still quite healthy, kept up with heart checkups, but he often skipped the dentist. When he finally came to see me, his gums were swollen and clearly infected. He told me he'd been feeling tired and short of breath lately, figured it was just old age. But after running some tests, we found that bacteria from his gums had entered his bloodstream and was affecting his heart. He was shocked I wasn't, because modern medicine has shown us this clearly periodontal disease. That gum infection can double or even triple your risk of heart attack or stroke. Why? It's simple. Your mouth is the gateway to your entire body. If bacteria get out of control in your mouth, they don't stay there. They travel through your blood, to your heart, your liver, your brain. A major study from NYU found that people with chronic gum disease are up to 70% more likely to develop dementia. Why? Because oral bacteria can cross the blood-brain barrier and cause silent inflammation, one of the hidden contributors to Alzheimer's disease. Let me give you a real-life example. Mrs. Helen, 73 years old. Her memory was declining. She would forget how to get home. Her daughter thought it was just aging, but when we did a full checkup, we found a deep gum infection. After treatment, her memory didn't completely come back, but it improved significantly. She started remembering her grandchild's name, something she had forgotten before. So if you're thinking wiggly tooth, just pull it. Toothache, just pop a pill. Please take a moment and rethink that. You're not just protecting a smile. You're protecting your heart, your memory, your future. I once read a study from Japan, a country with the oldest population in the world, that found seniors over 70 who still had 20 or more natural teeth were twice as likely to live another 10 years than those with fewer than 10 teeth. Why? Because teeth don't just help you eat. They help with digestion, nutrition, clear speech, social interaction, and above all, confidence. Older adults who still have their teeth tend to eat better, smile more, speak more clearly. And those small things, they help people live longer. So let me ask you, when was the last time you had a dental checkup? Have you ever thought that bleeding gums might be your heart asking for help? If not, I hope after watching this video you'll pick up the phone and call your dentist, not out of fear, but because you deserve full body health from top to bottom. And if you're caring for aging parents, remember this: taking them for regular dental checkups is one of the kindest, most powerful steps you can take to give them a healthier, more peaceful, and happier old age. Part 6. A fresh look at brushing your teeth after 60. By now, I think you've probably realized something important. We're not just talking about brushing your teeth. We're talking about a way of living, a gentler, smarter way of taking care of yourself as your body changes with age. Let me go back and quickly recap the 4 simple but powerful truths we've talked about. Not just so you remember them in your head, but so you carry them in your heart. Truth number 1. Don't brush your teeth right after eating. Wait at least 30 minutes. That gives your enamel time to recover. Think of it like a freshly molded piece of pottery. You wouldn't touch it right away, right? It's still soft and fragile. Truth number 2. Stay away from harsh whitening toothpastes. You don't need Hollywood white teeth. What you need is strong teeth. Teeth that aren't sensitive or worn down. Choose gentle toothpaste with fluoride made for sensitive mouths. Truth number 3. Don't brush too hard, and don't use a hard bristled brush. Your gums, especially as you age, are like delicate silk. They need to be treated gently. Use an ultra-soft brush and brush like you're washing a fine crystal glass. Truth number 4. Your oral health is deeply connected to your overall health. Bleeding gums, bad breath, or loose teeth. These aren't just small annoyances. They can be early warning signs from your heart, your brain, or your immune system. So please, listen now. I'll admit, I used to think I had all the answers at 65. With decades of experience as a dentist, I thought I'd seen it all. But it took my own tooth sensitivity, a few sleepless nights, and some of my older patients, who had better smiles than mine, to remind me that there's always more to learn. So wherever you are, 60, 70, or even 80, I hope you'll give yourself the gift of learning again. Let's start with some simple changes Swap your hard toothbrush for a soft one. Read the ingredients on your toothpaste. Wait 30 minutes after meals to brush clean your tongue every morning. Visit your dentist every 6 months. These aren't huge changes, but they're the right changes. And sometimes that's all it takes. My friend, if you're still unsure, remember this. It's never too late to change, and it's never too late to love yourself. Starting with your smile, you don't need perfect teeth. You just need strong enough teeth to enjoy a warm bowl of soup in the morning, to laugh with your grandkids. And to say, thank you, life, at the end of the day. Tone softens, like a personal message. I know the journey to stay healthy after 60 isn't always easy, but you're not alone. I'm Dr. David Jones, a man who's walked through many seasons of life. And I'll be right here sharing simple, honest, and useful things to make your golden years truly golden. Warm smile looking into the camera. If what I've shared today made you pause, made you smile, or made you want to change something, please share this video with someone you love. And if you feel like this is a place you can trust, a place you want to come back to, hit that subscribe button and turn on the bell. So each week we can meet again, like old friends reminding each other to live healthy, live happy, and live true. I'm Dr. Michael Sanders, wishing you a peaceful day and a smile that feels just right. Part 7. The paradox of being too careful. Can brushing too much actually weaken your teeth? You know, one of the things that's made me reflect the most over my 30-plus years in dentistry is how many older adults, especially those who are super careful with hygiene, actually end up with serious dental issues. And here's the strange part. Sometimes it's that very carefulness, that extra effort, that ends up making their teeth weaker. Sounds backwards, right? But I've seen it happen again and again, not just with my patients, but even in my own life. I remember this couple in their 70s. Harold and Clara picture perfect healthy lifestyle, smart diet, very mindful about their health. Mr. Harold was a quiet, thoughtful man who literally kept a toothbrush in his shirt pocket. He told me I brush after every single meal. Even snacks, I do it for 5 full minutes. Each time I just want to keep my teeth super clean so they don't go bad. But here's the thing. His teeth were loose. His gums were thin and sensitive. He had constant pain, and his cardiologist was starting to worry that the inflammation in his mouth might even be affecting his heart. So I sat him down. Not as a doctor, but more like a friend. And said, Mr. Harold, after 70, the body is like a garden in autumn. It doesn't need heavy storms or harsh sunlight. It needs gentleness. When you brush too long, too often, or too hard, thinking the harder I scrub, the cleaner they'll be, you're actually wearing away the enamel, which is already thinning with age. Every aggressive brushing session chips away at that delicate armor and stresses your gums. Enamel may seem tough like rock, but it's fragile like porcelain. Gums may seem solid like soil, but they're as tender as baby skin. I often compare brushing to washing a vintage crystal glass. You don't use a wire brush or scalding water. You use warm water, a soft cloth, and a gentle hand. It's the same with older teeth and gums. We don't need to scrub our teeth, we need to care for them. With love, with understanding, and with patience. I've even changed how I give advice. I no longer say brush 3 times a day. I now say, clean your mouth properly. Just twice a day, 2 minutes each time, with an ultra-soft brush and a gentle attitude. And Clara, Harold's wife, smiled so kindly when I told her this. She said, brushing teeth is like caring for an old friend. Being rough doesn't mean you care more. That moment touched me, because in just one sentence, she captured what took me decades to truly understand. The more gently we treat our aging bodies, the more they respond with strength. So if you've been thinking, the more careful I am, the better, maybe it's time to rethink that. It's not how many times you brush, it's how you brush. It's not what brand of toothpaste you use. It's whether you actually understand what your teeth need. If you've ever felt lingering tooth sensitivity, thinning gums, or loose teeth, even though you're brushing diligently, you're not doing anything wrong. You just need to adjust, and that small shift, I truly believe, won't just make your teeth healthier. It'll help you live more gently with more trust in your beautiful aging body. lower tone, more heartfelt. I say this not just as a dentist, but as a 60-year-old man who's also been hurt by his own overcare. I don't want you to have sleepless nights from tooth pain. I don't want you to hesitate to smile at your grandkids because your teeth feel weak. And I definitely don't want you to feel old just because of a small misunderstanding in how to take care of yourself. Part 8, your tongue. The hidden carpet of bacteria and emotional bad breath. I'd like you to try something real quick if you're somewhere quiet and have a moment. Stick out your tongue and gently scrape it from back to front using a clean spoon. Now take a look at what's on that spoon. See that white film that's not leftover food. That's a mix of dead cells, bacteria, food debris, and yeast, like a dusty old carpet sitting right on your tongue. Over the years, I've said this to hundreds of older patients. You brush your teeth really well, you floss daily, but your breath still smells because you forgot the tongue. Yep, the tongue, the most important part of your mouth, is often the one most ignored. I remember one patient, Mrs. Evelyn, 78 years old, who came to see me looking really upset. She said I brush and rinse thoroughly, but my daughter-in-law says my breath smells. I feel embarrassed. I don't even want to hug my grandkids. So I asked, have you ever cleaned your tongue? She looked surprised. Isn't rinsing enough to keep it clean? No, definitely not. The tongue holds more bacteria than your teeth. If you don't clean it daily, that gunk produces volatile sulfur compounds. Basically the main reason for bad breath, dry mouth, even poor taste and weak digestion. I like to call it the breath of memory because it doesn't just affect how we talk. It affects our confidence and even how connected we feel to those we love. No one wants to be avoided just because of a smell that they can't even sense. And no one should carry shame for simply forgetting to clean a small part of their body. Cleaning your tongue is super simple. All you need is a stainless steel tongue scraper or the textured back of a toothbrush made for tongue cleaning. Do it every morning when you wake up and after brushing your teeth. Gently scrape from the back of your tongue forward. Don't be too rough, just consistent. In a few days, you'll notice. Your mouth feels fresher when you wake up. Your breath smells cleaner. Food starts to taste better, and most importantly, you'll feel more confident around others. Your tongue doesn't just help you speak, taste, and chew, it's also your first line of immune defense. A clean tongue helps prevent bacteria from traveling to your stomach, lowers your risk of gut inflammation, and even protects against sinus and throat infections. Especially in older adults, I once called the tongue the silent gatekeeper of your digestive system. It protects us daily, yet we often overlook it. An 80-year-old patient once told me after a month of daily tongue scraping, "Doc, my mouth feels as fresh as mountain spring water every morning. I feel lighter, like I just want to smile." And I smiled back. Because to me, wanting to smile, that's one of the best signs of true wellness in older age. My friend, if you're looking for one small habit that could improve your health this week, start with your tongue. Clean it every day as an act of self-love. Because you deserve a breath that feels light, a smile that feels natural, and hugs that feel close. Part 9, teeth. They're not just for eating. You know, the older I get, the more I realize this simple truth. Teeth aren't just for eating. They hold memories. We usually think of teeth as tools, to chew, to talk, to pronounce words. But really, they're silent witnesses to a lifetime. I once asked a 90-year-old gentleman living in a nursing home, if you had to choose between good eyesight or strong teeth, what would you keep? He didn't hesitate, he said. I'd keep my teeth. Because even when my eyes go blurry, I can still sit down and eat a meal with my wife. That answer stopped me in my tracks. Another patient of mine, June, 82 years old, broke down in tears in my office the day I had to remove her last front tooth. She wasn't crying from pain. She said, "This tooth's been with me since I was a school teacher. I smiled at my students with it. I bit into wedding cake next to my husband with it. I taught my daughter to chew an apple. With this very tooth, losing it feels like losing a piece of my life." We forget sometimes. Each tooth is more than just enamel and nerve and gum. It's a little frozen memory. It's that wisdom tooth that kept you up all night at 25. reminding you that you were once young. It's the molar you chipped when you fell in 7th grade. A little crack from childhood. It's the front tooth you broke laughing too hard, because someone told a joke at just the right moment. It's the teeth you used to bite into that juicy mango in the first days of summer, to slurp a hot bowl of pho, to laugh out loud on your 70th birthday. And when we lose teeth, we don't just lose a part of our body, we lose a feeling. A memory, a connection to our loved ones, to the food we cherish, to the version of ourselves we once were. That's why I always tell the older adults I meet, take care of your teeth like an old friend, one who's been with you quietly for decades, steady, enduring, asking for nothing. Because keeping a tooth isn't just about chewing. It's about joy. It's about holding on to the flavor of life. It's about being able to laugh, to kiss your grandkids, to say grandma loves you. It's about holding on to yourself in a world where everything else is changing. So if you still have your teeth, be grateful if you've lost a few. Take care of the rest. And if you're caring for your aging parents, help them hold on to this small thing. Because it's not small at all. My name is Dr. Michael Sanders. And I truly believe getting older doesn't have to mean losing everything. Sometimes it means holding on to your teeth, to your memories, and to the deep, quiet gratitude for the body that's carried you this far. Part 10, Final Thoughts. Take care of your teeth. Take care of your life. My dear friend, we've just been on a journey together. Not just a journey about brushing teeth, but a journey about rethinking how we take care of ourselves as we age. I'm not here to scare you with stories about disease. I'm not here to give you a bunch of strict rules either. I'm simply here to remind you of one simple truth. You still have so much to love in this life. And the first thing you should love is your body. Maybe you've been around for more than half a century. Maybe you've lost a few teeth, worn down some enamel, or even missed a few good nights of sleep because of sensitive gums. But guess what? You're still here. You still have today. And today is enough to begin again. Start by brushing a little more gently, choosing a softer toothbrush, waiting a while after meals before brushing, scraping your tongue each morning, and most importantly, seeing your mouth. Not just as a tool for chewing, but as a vital part of your heart, your soul, your life. You might be watching this video in your cozy old kitchen, the same place you've shared countless meals with family. Or maybe you're lying on the couch, gazing out the window as summer slowly rolls in. Wherever you are, I just want you to know this. You are not alone on this journey of aging with grace. I'm here. There are people out there just like you. And there's a whole community of folks who care deeply about their health. Not with just pills and treatments, but with knowledge, with kindness, and with real self-love. Thank you for spending this time with me. If something I shared today made you think, made you smile, or maybe even inspired you to make a small change for your health, then I believe this video has fulfilled its purpose. If you found this helpful, don't forget to hit that subscribe button so you won't miss any future insights from me, Dr. Michael Sanders, and share this video with someone you care about. A friend, a family member. Anyone you want to see stay healthy, happy, and here for a long, long time. See you in the next video. Wishing you a calm, beautiful day with a soft, peaceful smile.